So I'd like to introduce you to France, who's 45 years old and doesn't look it. So what we're going to do is we're going to take a look at France with respect to our assessment of how we can beautify. And what I mean by beautify is taking a beautiful face and kicking it up a notch higher, making it even more beautiful, releasing her maximum beauty potential. Because really, contour-wise, she's doing very well. There are certain aspects that we can enhance, and that's what we're going to look at right now. So sometimes it's overwhelming to take a look at a face and decide exactly what you want to do. It's kind of looking like you're looking at a blank piece of paper and you can't decide, you have writer's block. Where do I start? The simplest thing and the way that I do it is I divide the face into thirds. So I look at the upper third, the middle third, and then the lower third. And then I can concentrate on each individual area a little more specifically with a little more focus. So, if we take a look at her forehead, there are certain issues about her forehead that perhaps we would love to treat. She has some transverse lines over here that are as a result of repetitive movement of the muscle. They can be softened. Most of the time we use a neuromodulator or neurotoxin to do that. Occasionally these lines are ingrained and we can use a very fine product like Stellest Soft, if they were very deep and a little more furrowed, to soften those lines as well. But she's actually doing not too bad over here. She hasn't got really intense look over here or intense lines from the glabellar region or the procerus. But what we do notice on the upper third of the face is the fact of her brow position. And her brow position is sitting slightly low, which is typical for around the age of 40-45 is when we start to see this little bit of brow ptosis. Normally the brow should be sitting a little bit up like that, around a centimeter above the infraorbital rim in most women. In men, we don't mind to have a little bit of a flatter brow and a straighter brow. It's a little more masculine. And in actuality, her brows are giving her a little more of a masculine look over here, and we want to feminize them by raising them slightly. Now we all know how to do that by putting in neurotoxin over here to elevate the tail of the brow by softening the depressors, or the orbicularis in this area, as well as the corrugators over here and depressor supercilii and even the procerus. What we're going to try to do with France today is we're going to use actually a little bit of product. The product I've chosen is Fortellus because it has very, very good lifting potential. And I'm going to try to slightly elevate her brow just to give her a little more of a feminine arc to the brow and give her that little Fabergé egg that we love to see. The other issue, whenever we're assessing the face, is make sure that not only do you assess it from the AP view, but you always assess it from the lateral view as well. Because there are things that you're going to miss. Most patients, when they look in the mirror, will be looking in this direction and see themselves face on. Most of their friends will see them from all angles. So one of the other things we notice on her is the fact that she has a little bit of temporal depression over here. This could be genetic. We also see it as a little bit of atrophy that happens as we age. What makes me decide on whether I want to treat that area or not is discussing it with the patient first off to see if this is something that's been present for a long time. And also to see if the eyebrow appears to disappear around the corner. When you look at her from the front, you can see that her eyebrow seems to disappear around the corner because of the fact that there's no support in this area. So what we're going to do is we're going to put in the same product that we were talking about with raising the brow. We're going to put the same product in over here, a little Fortellus, that's going to go on the periosteum of the bone just to flatten the contour here. What we're looking for is to have a slight concavity or a flattening, but certainly not to make her convex over here. She's doing quite well with her tear trough area. She has a couple of little iridids that are over here from the crow's feet. Those ideally would be treated with neurotoxin. We're not going to address that. And that's the upper third. Then we come to the middle third of the face, and what we look at in the middle third of the face is to see if we have established, or she has already, a natural contour, which we call the Auger curve, going from slight concavity to convexity on her cheek. We don't like to see undulations. We like to see a nice smooth contour, and that's not only on this view, but also from the coronal view, where we want to see a natural contour to the front part of the cheek as well. The OG curve that we talk about is just not only with respect to the profile of the face or the contour of the face, but that OG curve exists in many, many different areas of the face. In fact, it's only natural and youthful to have multiple OG curves, and it's not natural to have perfectly straight lines. We don't want a perfectly straight line over here. We want a natural curve. She's doing well along her jawline over here. She has a little bit of a pre-jowl sulcus. This can be slightly improved by just ovalizing the face. To have an oval face is a youthful face. We can ovalize with a little bit of product that we're going to use over here as well. Now, one of the interesting things that I've found with beauty is the fact that we seem to assess beauty by how well proportioned the face is. And the phi proportion is a value of 1.618 to 1. So just to show you how phi France is to begin with, and what we're going to try to do to make her even more phi, I've brought with some calipers. It helps me with the assessment of the patient. It helps me with getting the patient to get over the hump of thinking only purely lines and into thinking in terms of beauty. So what is this caliper? Well, what it does is that no matter how you open the caliper, this distance between the smaller two prongs over here, if it represents the number 1, then this distance, which is the other side of the caliper, represents 1.618. So no matter how you adjust these calipers, whether they're very wide or they're very short, the ratio is always going to be 1 to 1.618. So let's measure her and see how she does. Can you fermer les yeux, s'il vous plaît? We're going to close her eyes now so she doesn't get nervous about this, and we're going to take a look and measure the distance between her medial canthi. The medial canthus, to me, is the only cutaneous landmark that we have on the skin that doesn't change with time in adulthood unless there's a disease over there. Otherwise, if there's no disease, if there's no basal cell situation that's happening over there, if there's nothing happening with respect to the skin issue over there, that bony landmark will remain the same throughout the adult life. So we now have a reference point, and that reference point we're going to use as 1. So let me show you how phi France is. If we measure the eyebrow, we'll see that her peak is exactly 1, and that her eyebrow width is 1.618. So she's doing very nicely with respect to her brow. With respect to her brow, the brow should start at a level that's just to the medial canthus over here. So women, when you're plucking, you should be plucking just to the medial canthus, not here and not closer over here. That's the ideal. A line drawn from the medial part of the eyebrow down through the medial canthus, down through the outside part of the nares over here. That's a straight line that's coming down. That's where the eyebrow should start. You don't need these calipers because there are landmarks that we can use that will give us the phi proportion as well. So if we take a look at where her angle is, where the peak of her brow is, if we were using toxin to try to do this, we would try to elevate like this, not like this, and not like that. We would try to elevate it where the peak is so that we get that peak at phi, which is almost 2/3 of the way along there. That peak also represents, if you take a line that is drawn from the nasal base over here through the outside of the pupil, that's exactly where the peak should be. And as far as where the eyebrow should end, it's from the nasal base through the lateral canthus right here. So if we were to measure her coming across over here, her brow could be adjusted a little bit and trimmed just a bit back over there for length. But that shows us with respect to the phi. Phi as well is the height of the forehead. This is 1, and this is 1.618. So her forehead is good. And she knows that because she's wearing her hair up and back like that. The other thing that we're going to look at is the width of the base of the nose. The width of the base of the nose should be the same width as the inside of the eyes, and that's 1 over there. The length of the nose, from the radix down to the tip, should be 1.618 or phi to the middle over here, and it is in her case. The width of the mouth should be phi, 1.618. Now this helps you think that not only should we be thinking in terms of lip height, but we should be thinking in terms of how much of the lip width is actually apparent on a patient. And that width should normally come to the inside of the iris, which is phi. And if you're Angelina Jolie, you can take it all the way to the inside of the pupil. She's changed our whole concept about lips. Width of the chin, about the same. What other phi things do we have on the face that we can look at in her because she's beautiful? Well, the concept of using volume to replenish the cheeks is the concept that's been compared to refilling a deflated beach ball. The problem is that the skin that she has now is not the same skin that she was born with. It's lost its hydration and its elasticity. And if we try to volumize her to the point that she would lose any type of lines or even soften these folds, she's going to be too wide. So what is the ideal facial width? To me, the ideal facial width, and this is after measuring the top faces, probably 100 top faces of the top models, and they all seem to mark out this way, is if you take a look at the facial width is usually phi to the center. And when we measured France before, we found from the front view that she was almost perfect on this side. She can use just a little bit of volume and lacking a little more on her left side. And if you take a look at her now and critically assess her, you can see that her right cheek has a little more fullness than her left cheek. And this is showing us exactly what we were talking about by using the phi. So what we're going to do is we're going to optimize her cheek by doing this. Slightly on this side, a little more on that side. And as we do that and give her the volume over here, you're going to see the strain come off of the nasolabial folds. We're going to blunt this area slightly. We don't want to get rid of everything over there because that's a simian or monkey type of look. We're going to blunt that slightly. And I think we might put a little product in over here. As far as her lips go, we discussed it. I think in a situation where you have a little bit of excess length over here, she's a little high for the bottom part of her face, you don't want to draw too much attention to this area. If you put in some big, huge, luscious lips over here, this is where people are going to look. It's not her best feature on her entire face. We want them to concentrate more on this. And again, as I said before, always assess the patient from the lateral view because you'll miss things. We have to elevate this. We have to put the cheek apex where it belongs. We have to perhaps soften a little bit of the nasal bump over here. We can do that because if you look at her lashes, that's where the nose should normally take off. She has a nose angle over here, a nasal frontal angle that starts a little teeny bit low, and we can get away with going ahead and just heightening that a little bit and softening that bump ever so slightly. Things that we would miss if we wouldn't look at the lateral. Her chin projection is quite good. With a woman, it should be somewhere around 1 millimeter behind a line known as Steiner's line that's drawn from the upper lip through the lower lip. It should be about 1 millimeter behind, which she is, or up into that line. In men, you want it at that line or forward. And she still has this elevated height over here, and you can see the height that she has between her nose and her lip because of the slight pull on her nose over here from the nasal spine. So we don't want to do too much to augment this area over here, but we do want to highlight it a bit. And if we were to highlight it, where would we put the Cupid's bows? Well, if you measure the height of her lip over here, and this is what we talk about in beauty, if we measure the height, her Cupid's bow would be about that wide over there. That's where her Cupid's bow would be, but the philtral columns would be just to the inside of that, because an aging feature is to splay your philtral columns. And we want those philtral columns to be just to the inside of where the Cupid's bow are, and perhaps extending up 1/3 to 1/2, but not all the way up to the top of the nose in an older patient.